Hi, may I come in?
Yes.
Hi, I'm Sarah Fordham. I'm a nurse practitioner here, and you're Joe May. How would you like me to address you?
Joe is fine.
Okay. Well, I work with Dr. Jones here, and I can treat you, assess you, and prescribe medicines also.
Okay.
So, are you familiar with nurse practitioners?
Yes, a little bit.
Okay, all right, great. So, tell me, what brings you here today?
My goodness.
Oh, is that your phone?
It is. I'm so sorry.
That's okay.
I forgot to shut it off.
Here you go.
Thank you. I'll shut it off.
No problem.
I always forget to do that.
I do that too.
All right. Thank you. I haven't been feeling good. I've had a cough and a fever for the last 7 days. It's just, it started a week ago, and it hasn't gone away. It's just gotten worse.
Okay, so cough for, did you say 7 days about?
Yeah, for about a week.
All right. Tell me a little bit more about that. Do you have any mucus or anything that you're coughing up?
I do. It's, it's like a rusty color. It's the best I can describe it. It's just rust colored, sputum. I'm tired and my chest hurts. I have the chills. I'm not feeling well at all.
Now, does anything make that cough better or worse?
At nighttime, it's worse. When I'm laying down, that's when I really can feel it, and then I'll just start coughing.
Okay. Now, do you get that chest pain only when you cough, or at other times too?
It's mostly when I cough. If I move around, I can feel it too, but it's just mostly when I'm laying down and.
Okay, so that makes it worse.
Mm-hmm.
Have you taken anything for the discomfort or for the cough to make it better?
I have. I've taken Tylenol I'm having this fever too, and I've been taking the Tylenol, and it helps for a little bit, but the fever just keeps coming back.
All right. What about how is it affecting your life? Are you able to still function, or is it?
No, at first I could, but for the past 4 days, I couldn't even function enough to go to work. I haven't been feeling well enough.
Okay, all right. Well, I'm just going to ask you some general questions right now. First, I'm going to start with allergies. Do you have any allergies to medications?
I don't have any kind of allergies to anything.
Okay, so what about allergies to foods or environmental type allergies, latex, penicillin? Okay,
No.
What about medications? Do you take any over-the-counter? I know you mentioned some Tylenol. Well, what about any other over-the-counter or prescribed medicines or vitamins?
No, just Tylenol. I take that. I take about 2 of them, so about 650 milligrams I take.
Okay. What about any alternative type therapies you try or that you use?
I haven't really tried anything else. I just haven't felt well enough.
Okay.
That's my other.
Oh, let me grab that.
I'm so sorry.
That's okay.
I haven't been to work in a while, and everybody's just been trying to get a hold of me, and I just haven't been well.
That's tough. That's tough. Okay. Well, so that's about your medications. What about, I'm just going to ask some general information about your past medical history. Have you had any hospitalizations or surgeries?
I haven't had any surgeries.
Any trauma?
No, nothing. I haven't really had anything.
Have you?
No medical problems. I've not been diagnosed with anything in the past. So.
All right, so you've been pretty healthy. When was your last trip to the doctor for anything? Do you recall?
I would probably say about 4 months ago I had a physical for work, and so I was there for that. While I was there, they did like a PPD test.
Oh, okay.
And that was negative.
Oh,
at
good.
the time, so.
All right. So that screens for tuberculosis. What about any other immunizations? Have you had within this last year for flu or pneumonia, the pneumococcal vaccine?
No, I haven't.
Okay. What about any history of chronic diseases such as hypertension, diabetes, asthma?
No, I haven't had that, but I've had some family members that have had some
Oh, you have?
problems.
Okay. That's what I was going to actually get to next. So thinking of your first degree relatives such as your parents, your siblings, any of your children, any family illnesses such as what I would like to try to hit is hypertension, heart disease, cancers, allergies, asthma. Yeah, any of those you can think of with those relatives.
My mother, she had high blood pressure. She also had congestive heart failure.
Okay.
She passed away at 75.
Okay.
And my father, he also had high blood pressure. He was a smoker, so he got lung cancer from that.
Oh, I'm sorry to hear that.
And he also passed away early at 65.
Okay. All right. So, what I would like to ask next is some personal and social history type questions, just because it helps me get to know my patients a little better, and just look at their overall health. So, what's your living situation? Are you married? Are you single?
Nope, I've never been married. I'm single right now.
Okay.
I was a postal worker for a long time, but I'm retired now, so I just, I do a lot of things around the house.
Okay. Tell me, do you have any hobbies or church activities, anything that you like to do socially?
I just like to, do things around the house, and I do things for other people. Since I don't have my postal worker job anymore, I still, like to help other people out, and I haven't been able to do that for the past couple of days. So.
Okay, all right. So, what about any alcohol? Do you have a history of drinking alcohol, or do you presently drink alcohol?
I do not know.
Okay, what about tobacco or cigarettes?
Well, I do smoke cigarettes, unfortunately, which hasn't helped with this whole cough and chest pain. I've been smoking a pack a day for a long time, about 45 years.
Okay. Yeah, that is quite a while. All right, so what about any other habits, such as any drugs, marijuana, cocaine, anything?
I don't do any of that. I'm part of a church group, and so we stay out of that kind of stuff.
Okay. What about, are you in any relationships, and are you sexually active?
No, I haven't been for a long time.
Okay. And have you traveled outside the country in the last 6 months?
No, not at all.
Okay. Now I'd like to just ask you some general information. All that's very helpful. Thank you for answering all those questions. But now I'm going to do just a little review of systems. Basically, going to go head to toe so I don't forget or miss anything. And you tell me how you feel about these. So, you mentioned, I believe, some chills. What about any fever?
Yeah, I've had quite a high fever, like 103, and the Tylenol knocks it down a little bit, but it still just keeps coming back.
Okay, that's right. You mentioned that. So, what about? And you mentioned you're retired. What about any weight loss or night sweats?
No, nothing like that.
Okay. Now, what about any changes in your vision or eye problems?
No eye complications.
Okay. What about any changes in your hearing or pain in your ears?
No, nothing like that.
Okay. What about any sinus pain or nasal congestion or a runny nose?
No, it all feels like it's just stuck in my chest.
Okay. What about frequent upper respiratory infections?
No.
Okay. What about any sore throat or voice changes?
No, nothing like that.
Okay. What about any neck stiffness or neck pain or lumps or bumps?
No, nothing like that.
Okay. What about any heart problems or you mentioned the chest pain with your coughing? Any other shortness of breath, like for example when you go to do some exercises or exert yourself?
No, it's been okay. It's just mainly when I'm coughing.
Okay. What about at nighttime? Do you have to get up frequently to urinate?
No.
Okay. What about moving on to your chest and respiratory issues? So, any shortness of breath?
Occasionally shortness of breath, but mainly when I'm laying down and I'm coughing.
Okay.
Otherwise, it's okay.
With your cough, have you noticed any blood in your sputum?
No.
Okay. All right. What about any issues with your belly? Any belly pain?
No.
What about your peeing and pooping okay? Any swelling in your extremities or weakness or pain in your joints?
No, not that I've noticed.
Okay. All right. Good. So with all that, I'm gonna now take a look here, and I'm just gonna go head to toe.
Okay.
And then first I'm gonna start with just kind of feeling around in your facial area, and you let me know if you have any discomfort, okay? And just kind of feeling around to see if you have any sinus issues or any lymph nodes maybe enlarged. Okay. Right here, okay. Okay to move your neck around, any stiffness there?
No.
Okay, good. So now I'm gonna just kind of look at your eyes, and I'm just gonna, first I'm gonna check and see how they react to light.
Okay.
All right. So go ahead and stay looking at my nose. One more time. Okay, very good. All right, so I'm going to have you follow my finger here, okay? So I'm gonna just go in a little star pattern here. Okay, now I'm going to have you look at my finger and then look straight behind me.
Okay.
The wall. Now look at my finger and look straight at the wall. Okay, very good. I'm going to now take a look at your ears.
Okay.
And you said you haven't really noticed any changes, any pain in your ears.
No, not that I've noticed.
Okay. I'll just take a look. Let me know if this is uncomfortable at any time. Okay. Pardon me, this cord's not very long. Very good. Okay. They look clear. All right, now I'm just going to take a look up your nose, see if I see any discharge, any changes there. And you said not really any nasal congestion, huh?
No, it's
That's
just
good.
Yeah.
Now I'm just going to throw that away. And I'm going to look in your mouth. If you can just say, ah. All right, good. And say ah again, and take a swallow, and then take a breath. All right, good. Alrighty. So I think what I'll do now is I'll listen to your lung sounds. Okay, just nice. You know, normally I would do this whole exam, skin to skin, you'd be in a gown, but we just don't have those ready today, okay? I apologize.
No problem.
Alright, good. I'm going to just do this, we call this percussing, to see if I notice any changes here. Pardon me. Alright, now I'm going to listen from the back. Nice breaths in and out. And then I'll do some percussion. Okay, let me see. Now can you take a deep breath here? Okay. Oh, well, your lungs are expanding. Very nice. All right, now I'll listen to your heart. All right, very good. You know, let me just check down here for some edema. Okay. Thinking of everything we've talked about today and what I've noticed here is I'm thinking you have either bronchitis or pneumonia. Okay.
Okay.
So with that, some things to consider, some promotional activities, things you can do in the future is I would really recommend getting a flu shot every year because the flu shot actually can cause pneumonia, secondary infection, and then also I'd recommend getting a pneumococcal vaccine every year because you have a couple risk factors. You're 65 and you're also a smoker, okay?
Yeah.
So they really recommend it for those. And then also, considering that you've been smoking for quite a while, the tobacco, really damages your lungs and it makes it hard to fight off infection. So, with that, when you get bronchitis or pneumonia, it takes it longer, your body takes longer to heal, okay, to fight off that infection. So just some good general practices are always to get a healthy diet, regular exercise, and enough rest, okay, because all of those together will help fight off infection and also promote speedy recoveries, okay? So thank you very much for your visit today.
Thank you.